Good evening, everybody. I'm Dr. Rajeev Gandhi. I'm a consulting nephrologist practicing in Mirrors for last 40 years. Today's topic is pedal edema and CKD, causes, symptoms, and treatment. Uh, Welcome to today's session on pedal edema and chronic kidney diseases or CKD. Today we will explore what pedal edema is, its causes, and how it relates to CKD, the best ways to manage it. First, let us see what the pedal edema is. Pedal edema is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for several reasons, such as heart problem, liver problem, thyroid and thyroid diseases, kidney problems, and blood clots. Our body fluids are divided into two main areas: inside ourselves and outside the cell. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is problem with flow of fluids are disturbed between these areas. The problem can happen if too much pressure builds up in the blood vessels, often due to the heart issues or excess fluid. It can occur if there are not enough proteins in the blood, like albumin, which can which keep fluid in the vessels. Additionally, the lymphatic system normally helps move extra fluid and proteins back into the blood. But if this system is not working properly, fluid can build up and cause swelling. The kidneys play crucial role in regulating the blood body fluid balance. The kidneys help to remove waste and regulate the fluid. When they are not functioning properly, the fluids accumulate, leading to edema, as seen in CKD or acute kidney injury or nephrotic syndrome. Edema is one of the major symptoms of CKD. Let's explore how the clinicians approach to the diagnosis of edema. First, a detailed history helps to identify risk factors of underlying conditions such as heart, kidney, or thyroid disorders. Edema is generally localized in the legs and occasionally it happens on the face. Edema can be either generalized or localized. During physical examination, clinician looks for pitting edema, that is, if on pressure, applying the pressure as indicated in the heart failure or nephrotic syndrome, there appears a depression, and that is called as pitting edema. Non-pitting edema is when there is no depression when applying the pressure. This suggests lymphatic obstruction or hypothyroidism. In cases of renal disease, the following lab tests and imaging are helpful: CBC renal function test, including serum creatinine, urine analysis, urine microalbuminuria, urine albumin to creatinine ratio, as well as the ultrasound of the abdomen and pelvis. A thorough history and physical examination are key to identifying the systemic causes, and specific signs guide the management plan. When it comes to managing the edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential alongside addressing the underlying issue. For systemic causes, a combination of general measures and targeted treatment is needed. For local edema, non-pharmacological measures limb elevation, compression therapy, physiotherapy, and ice application. In cases where the systemic causes are at play, such as in CKD treatment, focuses on the reducing the fluid retention and addressing the underlying condition. This involves salt restriction. Limiting the salt intake helps prevent fluid buildup and manage volume overload. Diuretics, these medications increase the urine output and help manage the fluid levels in different types include loop diuretics like furosemide, torsemide, often preferred for their effective and longer duration of action. Thiazide diuretics like metazolone are used adjunctive therapy for with the other diuretics. Potassium sparing diuretics, that is spironolactone, they are useful due to they prevent uh, the risk of hyperkalemia. The choice and the dose of diuretic depends on the factors like severity of edema, patient's hemodynamic status, and kidney function. It is important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, and electrolyte imbalance. Regular monitoring of fluid volume, urine output, and blood pressure and weight and periodic tests is essential. In chronic kidney disease, managing edema often requires salt and fluid restriction. This is essential for control of fluid retention. High dose of diuretics like loop diuretics, furosemide, given at higher doses. Managing edema involves a tailored approach for local causes, not for local causes, non-pharmacological methods are key, and for systemic causes, it requires dietary adjustment, diuretics, and close monitoring. Patient education is crucial. Understanding of the condition following the treatment plan and making lifestyle changes can improve the outcome. Early recognition and effective symptom management help prevent the complication. Thank you.